So for people watching this recording, I started recording late, but I'll do some backtracking. So if you want to create a resource wall at your center, which I highly encourage you to do, I have actually been really surprised at how quickly the handouts went out. So people are taking them. So it's a great way to kind of get, especially I noticed the trauma ones go really quick, and the substance use ones, the alcohol and marijuana ones go pretty quick, and so does sleep. But honestly, they all do. I've smoking up there actually, and that one actually doesn't go as fast. So those are general educational handouts. We also have information here for, this is the provider ride numbers, which are always good to have on hand. Here's the suicide assessment guide. You can also order these from the SAMHSA score. The safety suicide assessment guides. What else? Here's a suicide safety plan. So if you ever do want to create a safety plan with a patient who is having suicidal thoughts, this is a wonderful template to use. All of these you've seen before. So which ones do I want to go over? So this behavioral health referrals. So I encourage you just to print this out, have it on hand. And I also encourage people, if you have questions about behavioral health referrals, Ms. Marvella Donald is our new behavioral health director. She's replacing me and Dr. Staniff, basically. And she'll be overseeing our MAT program, as well as the rest of our behavioral health department. Please continue to consult with her. She said she is open to that. She's going to have my same extension, 1178. So if you're trying to figure out the exact right referral for somebody, please do call and communicate with her about that. But some go-tos, if you don't have the opportunity to talk to her about it and to get some familiarity with it, can be found here. So as a lot of you have noticed, psychiatry is, or if you don't know this, if you're referring to the big hospitals for psychiatry, people are getting put on wait lists for months and months and months. Or they're just being told to not even bother. And but when they get called a schedule, they just get referred out to other community agencies right away. So psychiatry is really inaccessible right now. One option for psychiatry that I found is this place called Psychiatry Network. They're telehealth only, but they've been getting people in for me in about 6 weeks. And I've had no problem with them accepting our patient's insurance or anything like that. However, it's telehealth, it's it's medication management only. It is excellent and perfect if that's all your patient needs. But if your patient has more like complex mental health needs, where they're going to need like case management or other services, or they're going to struggle with telehealth, that's not a good referral. But for if someone comes to you and they're like, I'm on Haldol and I just really need my Haldol, or anything like that, Psychiatry Network is a really good option. Murtis Taylor, Ohio Guidestone, Recovery Resource. Recovery Resources has a walk-ins, so I think that is really helpful. Signature Health. All of these places address psychiatry, mental health, and substance use, so that's helpful. So you can refer for all of those things. And they have higher levels of care. They have caseworkers, they have IOPs, which are intensive outpatient programs, so meeting multiple times a week. Ohio Guidestone has programs for family therapy, family visits, et cetera. I will say that Ohio Guidestone appears to be extremely overwhelmed, and people are having trouble getting things scheduled. And I don't really have an alternative, but I would love to know if anyone else does have alternatives for that. Inpatient treatment. So if you know that somebody needs inpatient treatment for substance use, you have two options, Highland Springs or Stella Maris. For psychiatric, Highland Springs is your best option. And they have 24/7 to do the assessments there, and they can let you know when a bed's going to be available. Other emergency resources is we've got Frontline Mobile Crisis, St. Vincent Psychiatric ER. You can always call ahead to St. Vincent Psychiatric ER and give them like a summary of who's coming in. I think that can be really helpful. If you're hoping for somebody to be seen. However, if the psychiatric emergency is that somebody needs medication that they have not had access to, unfortunately, the psychiatric ER is not always the best way to get them that. Usually they'll just be sent home and told to call and schedule. So just be wary of the fact that it might not necessarily get your patient's medication any faster, unfortunately. Same thing with Frontline. Frontline is a great resource to give to patients to use for family members when they're in crisis. I think that Frontline can be really excellent for that, for helping families connect to resources in the midst of a crisis for a family member. We've got peer support and Magnolia Clubhouse. Any questions about these resources? Dr. Yo said, any helpful hints on how to get support from center directors for bulletin boards? I do not, except for I'll follow up on this before I leave. I know a long time ago, the center directors were told to create resource walls at each of the centers. And I know that things absolutely have to go through center directors to be approved. But I think that we kind of lost track of that directive at some point. And so I will revisit that. Because again, the resource walls have been great here. All right. So I'll get out of this. So that's a list of resources. And then this community resources is the other list of resources. So those are like the two big posters that I want you to have in your office so that you don't have to Google, you have these things offhand. Child and Family Services, Victim Witness Service Center. The Domestic Violence and Child Advocacy Center is now called Journey. So that name has been updated. Everything else on here should be good. Including, I believe those are still the updated extensions that are correct. I think I checked with Chiquita for our social work representatives. So paper-wise, this is where you can find your papers. Let's see, screeners. So I created a whole folder here for behavioral health screeners if you want to use them. So we've got the GAD-7 for anxiety. We have these diabetes scales, the ACEs for trauma, intimate partner violence screener, PHQ you already used, but it's in here, PTSD screener, and then the SCOFF for eating disorders. So these are all screeners that are Dr. Alto approved for using in your setting to identify these concerns. All right, so that's everything I have right now on the intranet. I will be adding this document to the intranet. It's not there yet because, like I said, I'm still working on it. Like as people ask me things today, I will add to it and then I will save it to the intranet. It's going to be links. We got links here to appropriate resources. Oh, and since I started recording late, let me go back. How you get into the intranet to find these things. In the intranet, you're going to go to shared documents on the left, and you're going to go to behavioral health services, and you're going to go to behavioral health resources and trainings. And then you see those 4 categories: handouts, expert, screener, and seminar PowerPoints. All right, sorry. Back to resource roundup. All right, local for Cleveland and Cuyahoga County. We've got adult protective services. So for patients who are over the age of 60, we all know that we're mandatory reporters when it comes to elder abuse. So if we're concerned about elders being abused, we have to report it. And you do that through the Adult Protective Services website. What I think people don't know as much about is that you can report older adults who are at risk of severe self-neglect. So because of dementia or other physical frailties, are older adults who are unable to care for themselves appropriately, are also, that is very risky, just like abuse. And you can use the exact same portal to report self-neglect, and a caseworker will investigate and follow up the same way they would with elder abuse. So I actually strongly encourage people to do that when people are, losing weight, not able to remember appointments, remember medications, and you're seeing a really, really big impact on their ability to care for themselves, and there's not a plan in place. Like, so if they've got family that are helping them, if you're, connected to home health aides and that's working out, but if they don't have appropriate support and you're seeing that happening and you're not able to connect with family about that, then Adult Protective Services is a great way to access those resources. Going along with that, with aging, Cleveland Department of Aging has some really great aging specific programs. So this website lists all of them. One I want to point out that has been very helpful for several of my patients, if you go under financial assistance, is this Economic Security Project. So they help with money and benefits and making sure that people are connected to the right benefits, managing money appropriately, and have ways to do that. And then there's also things on here specifically about gas and water, sewer bills, et cetera. So older adults who are having these types of financial struggles are entitled to these specific programs. And you can, if they call, so the same number that you call for Adult Protective Services, you call the same number to get resources for older adults generally in Cuyahoga County. It's all the same agency, all the same number. So if you call that number, or if you call patient's family, call that number, it's a great way to connect to all of these things. So you don't have to like go and figure out which program is best for them. I just want you to know that these programs are here. And if you want to do that, if you want to give people flyers and stuff, that's great. But at the end of the day, what is most important is knowing that you can get all of that information from the county for older adults from that one number, which will be you go to Adult Protective Services. They actually have the ability to report on using the website, which I often do. So report abuse now. It has this hotline number. So again, you call this number to report abuse, but you also call this number to have people do an intake to get connected to the appropriate services. So you use this number for everything for adults, older adults, which is 60 plus, to get connected to the appropriate resources. Okay, so there's those things. Cleveland Rape Crisis Center, I think people are pretty familiar with, but just to review, they're very well funded. They've got a lot going on. They have free counseling, free groups. They have a 24-hour hotline. They do advocacy for legal issues. They have people who will go to court with you if someone is pursuing a case. If anybody wants to go to the police for anything related to rape, sexual assault, child sexual abuse, et cetera, do not go to the police without going through the Cleveland Rape Crisis Center first. You should start there, get an advocate, and then go. So they're an excellent resources. See if I'm forgetting things. I mean, they do have a wait list for their counseling, but it's really excellent for people whose issues are especially related to sexual abuse. Their support groups are great. Yeah, I think I covered that. Okay. So that's the Rape Crisis Center. Journey for Domestic Violence has a new name, so you might not be familiar with it. Fancy rebranding here. They have a 24-hour helpline as well. And they have shelter, and you can use the helpline to get connected to shelter. You can use the helpline for safety planning. You can use the helpline to get advice. So this is also I give this number to people who have family members who are struggling and they want to know how to help their family members who are struggling with domestic violence. Obviously, you can give it to victims of domestic violence, but they also have some other programs. Let me see if I can find a good list here. Informed. That I think people are less aware of. It was listed. Okay, so they've got the emergency shelter, which I talked about. They've got domestic violence support groups and trauma therapy as well. So both Rape Crisis Center and Journey have free therapy for those services. Also have justice system advocacy again. So if you have a patient who is interested in getting a restraining order, protective order, they call it in Ohio, they need to call this hotline to get it. They will help you get a protective order. They will go through it step by step. You should not just go to the police and ask for help getting a protective order. You should do it with Journey. And they know how to do it. They'll follow up and they know how to advocate. So this is the one I did not know about, Safe and Sound Supervised Visitation Center. So it's not something you can just like call and use, but I think it's good for people to know that it exists. And this is a way for to have supervised visitation in domestic violence cases. It can be court ordered, and this is a way for to ensure safety, and can be just very comforting to know that this exists and can be used and recommended by the court when people are going through separation and custody disputes in the context of domestic violence offenders. So yeah, I just thought that was interesting, and that's one I didn't know about. All right, general check-in. I don't see anything in the chat. Anybody have questions so far? I'll just keep going. All right. Emily program is a national well-known treatment organization for eating disorders. They have all levels: outpatient, inpatient, intensive outpatient. If you have an eating disorder patient, get them to the Emily program. Circle Health has a syringe exchange program, the only one in the area. So you have patients who are injecting drugs, they should be going to Circle Health. They have a whole list of locations where you can do the syringe exchange on the website. So for overdose prevention, we want as many people as possible to have Narcan, which can reduce overdoses. And we want as many people as possible to have fentanyl test strips. These are tests that you can, they're like little strips that you put into drugs that will tell you whether or not the drug has fentanyl in it or not, and it can save lives. So there's a kid at Ohio State who died last week because he took an Adderall, probably to cram for exams, and he died because there was fentanyl in there. And a fentanyl test strip could have saved his life. So ways to get free fentanyl test strips to give to your friends, your family, your patients can all be found at this link. Overdose prevention tells you where to get both of those things. And I believe that Chiquita is working on getting us some fentanyl test strips to distribute as well. Frontline mobile crisis. I think we've talked about. So I put Social Security and disability offices on here because I think it's a question people get a lot and they don't know what to do with. So when patients are struggling with those applications, they can get help on phone. They can get help by going to the office in person if the offices are open, which they haven't always been open because of COVID. And so that website tells you the office, the numbers where people can go to get help with filling out the applications. You can fill out the applications online, but a lot of people are too disabled to successfully fill out those applications by themselves and they need help. I also just highly recommend that people get lawyers to navigate that process in order to be successful and get the support that they need. Cleveland Mediation has some really cool services. That's one I didn't actually know about until recently. And I had at least one patient have a really successful experience there. So they have community mediation, family mediation, business mediation, landlord-tenant mediation, which can be really, really helpful things. For homelessness, I think most people know this, but just as a reminder, coordinated intake is the best way to go, especially for chronic homelessness. People, need to present to coordinated entry intake at the Cosgrove building, and then they'll be connected to the appropriate services from there. Oh, this one's really good. So Cuyahoga County Court has something called the Help Center. They have a brochure. I give this to a lot of people. So if people need to file paperwork about spousal support, child support, custody, divorce, any guardianship, not on here, but falls under it. And it's not related to domestic violence. So like if domestic violence, you should go to Germany and get an advocate there. But if you're doing these types of things, not related to domestic violence, but I don't know how many of you have ever filled out court paperwork. It's extremely complicated. Nobody could ever do it by themselves, but the Help Center will help them do it appropriately. They'll explain it and make sure that they're not missing any steps. I have notaries, etc. So this is a really cool resource that will help people. So it's not about legal advice. It's not about getting a lawyer. It's literally about filling out the paperwork correctly in order to get things on the docket, because people are very overwhelmed by that, understandably. Okay, national hotlines, suicide prevention hotline, they're changing it to 999. I'm a little confused about exactly when that starts. I feel like it's already supposed to start, but I haven't heard that much about it. But they're rolling that out. At some point, you'll be able to dial 999 and get to that, but it's the same resource as suicide prevention hotline. They're just changing the number. I always like to tell people about the crisis text line because lots of people don't want to call, but they will text. So you can text home to 741-741 and get a crisis counseling 24/7 via text, which is pretty cool. Human trafficking hotline will connect you to a local task force if that's the type of support that you need, and that can be incredibly helpful as well. General websites, you can get suicide prevention cards from the SAMHSA store. I have that link here. This is a website about serious mental illness that has like basic information about how to treat, how to approach, etc. That's super helpful. This is a website from CareSource so I'll show you guys what that looks like. None of us should be expected and can't be expected to remember every social service resource ever. So you can use this to search. So let's say we have one we're looking for help with food. They've got different food pantry options, different funding options to help pay for food, food delivery, goods. If you need somebody who needed help with medical supplies, with clothing, home goods, you see what I'm getting at. So this is a great way to get information about social services in Cleveland that you might not know about. As well as obviously talking to our excellent social services department and our people in behavioral health. But oftentimes if you're asking me something, I'm coming here to check it out. All right, so millions of things here. Dr. Hazra was talking to me recently about how she feels like she needs more training when it comes to acute mental health crises and how to deal with those, especially when there's not a mental health provider in the building. I recommended she do psychological first aid training. It's 5 hours, it's free. So you can ask her how that goes. And it might be something that you want to check out too. Oh, I love this website for adolescent health stuff. So just shout out to that. It has a bunch of different stuff on it, but if you're in peds and want some adolescent health things, they just have really, really cool stuff. Infographics and handouts and trainings and all sorts of different topics here that you can find. Sexual health, etc. that I love. Last thing, so self-help apps for mental health. There's a bunch of them. My favorites are the VA ones. They are free. They're developed evidence-based experts. They do use language about like veterans, etc., but they're for anybody. So I kind of tell people like, yeah, it's going to say veterans, blah, 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 blah. And some parts of it might be veteran specific, but it is meant for anybody who struggles with these issues, and they are truly excellent. AIMS is for anger. Beyond MST is specifically about military sexual trauma. So that would be less relevant. CBTI is for insomnia. And I would use that over the insomnia coach one. Mindfulness coach is great. Move coach is great. That's about increasing exercise, diet, and weight loss goals. PTSD coach is awesome. It has, we obviously want people to engage in treatment for PTSD, but sometimes people want to start with self-help and information and know their options for management. And PTSD coach will walk you through all of that. They've got a quit smoking one. So yeah, just wanted to let people know about the VA apps. All right, yeah, looks like some people had to leave. Thank you for coming. And I will stop screen sharing. Anybody have questions, things I can try? And if you think of things afterwards, please just email me. And like I said, I'm gonna save that with all the links and I'll put it on the internet, just like everything else I just. So you should have access to everything. If I forgot something, please let me know. And there's still Miss Donald will be here, my same extension. You can ask her. She has been in social services in Cleveland for much longer than me because I've barely been here for 2 years. So she has a lot of information about and connections in Cleveland, which I think will be very helpful for all of you to benefit from. All right, I'll stick around if anybody has questions, but otherwise, please feel free to leave, get your lunch, everything else. And I just want to say I've loved doing these seminars. And I appreciate everybody's enthusiasm and participation and positive feedback. It's meant a lot to me, those of you who show up and care. I'm a nerd. I love to talk about this stuff. And it is nice when other people like to listen. So thank you.
Thanks for everything.
Thank you, Dr. Yes. All right, I will stop recording. Forgot that part.